Good morning to you all. After that very inspiring talk, as Balagobi said, now I would talk about something uh, many of you may not want, and few of you may really want. The reason for why I'm telling is that, immediately after final year exam, some of you may think that, that the extent of medicine that I have studied is enough for several generations. Tamil, I would say, நாம் படித்ததெல்லாம் 7 தலைமுறை right? So that mentality will be there for nearly 90% of you. Though the fact that I'm going to say correct, the timing may be incorrect. Okay? So that is the first thing I would like to say. And at the outset, I would say that, many of you may be having a dream based on the teachers that you have come across and based on some other specialists you have seen outside Jaffna even. And that particular dream and subsequently the ambition you may have in your heart that I should become like her, I should become like that person. So that is how many of us decide our career. Of course, that's true, but decision making depends on many factors other than that. Apart from concentrating on few aspects about that, I will mainly talk about your career, which will go through the postgraduate Institute of Medicine. That is why my topic has been termed as career by PGIM partners. You understand what I'm telling? As I have already told you, we make up our mind about the future career based on, I like the job. I opted for becoming a surgeon because I liked performing surgeries. That's how, many of you may decide to do medicine because you would like to practice as a physician. So passion in that field is number one. As I told you, you may like the personality of a particular person or a professional you came across in your life. And as Dr. Gurubaran nicely highlighted, you may think in terms of, okay, I should earn some money because my parents are poor. They work hard, they trust themselves. That is why I came up to this level. So I can't allow them to work hard anymore. I must also earn money. That is true. Nobody can say no. Right? And of course, reputation in the society. You all know, just ordinary MBBS doctor, obviously he or she will have a reputation. But you come up in life a bit more, obviously you will be treated differently. And of course, considering the current situation of the country, you may have to search for a job in abroad. That is inevitable. Nobody can say you have to stay in the country, and nobody can say you have to leave the country. That is up to you. Okay? Now, you have come up to this level where you have passed the MBBS. Obviously, 99% of you will be doing internship here, or sometimes 100%. So once you have done the internship, you will have an SLMC, Sri Lanka Medical Council number. That means you are eligible to practice as a doctor in Sri Lanka with that. Okay? That's fine. Or, following internship, after obtaining the SLMC number, you may join a university as a junior lecturer. You can do MPhil, MSc, or PhD, and then you can progress in your life as a senior lecturer and even professor in that particular field. Okay? And some of you may think, okay, that's enough. working in the government sector. I will move on to private sector. Yeah, Northern Central is there, Learners Hospital is there in Colombo, and so many other private hospitals. Yes, you can work as a medical officer. Those categories, Happa, Sanumada, Sami, this is enough. I would like to become a very good husband working as an engineer doctor. I would like to become a very good mother who's looking after my children. Fine, that's up to you. So, these pathways will not involve postgraduate Institute of Medicine. Understand? So, what I'm going to talk for about 10 minutes is the pathway that takes you through the PGIM, right? Now, many of you may not be knowing what PGIM is, right? University of Jaffna has got several departments, like, faculties. Similarly, Colombo University will have several faculties. One branch, like a faculty there in Colombo, is the PGIM. So I'm going to talk about this pathway where you are going to travel through PGIM. So the Postgraduate Institute of Medicine is basically part of Colombo University, which organizes several courses for medically qualified person. Okay. Of course, the duration of courses, type of courses, and the quality of courses will differ. And you have chances to follow diploma course, MSc course, or MD course, Doctor of Medicine course. I mean, you have got the MBBS certificate now, you have done the internship, you have got the excellency, and then you are going through this particular one, so that in addition to MBBS, you can have diploma, you can have MSc qualification, or you can have MD qualification. All the details, you don't need to copy down what I say, it is there in the internet. There are links. Okay? For example, for a postgraduate diploma course, you just click onto this link and that's it. Details about the particular courses from A to Z will be there. Right? So, these are the types of courses. Can you see? I'm not going to read that because you can just log on to internet and you can find out. Starting from clinical hematology diploma in anatomy and palliative medicine, medical physiology, everything is there. Right? This is basically a diploma course, not an MD course. So by now, you have gone through the basic science, starting from the first 1.5 years, that is anatomy, physiology, biochemistry, then your paraclinicals and clinicals. You would have had a sort of extreme like towards subjects. Of course, if you are really keen, you can opt for one of these, so that you can have a diploma course. Of course, in addition to diploma course, there are MSc courses. Okay? The MSc courses again, medical administration, human nutrition, through community medicine, and so on. Like what I said for diploma course, you can opt for MSc course as well. Now, going for these two cases, the two different types of courses, diploma as well as MSc courses through PGIM, you should know this is basically a 1 or 2 years course. Right? And then it's useful to get your promotion. That means once you get your internship, you will be incorporated into the government sector as a doctor on probation. Then after 1 or 2 years, you will be confirmed. Then you must get either a diploma or MSc at least to get your confirmation and promotion with due dates. So that you can get the allowances and increase in the salary points. Otherwise, you will have to wait for 10 years to get the grade 1 promotion with MBBS qualification. So if you get MSc or MD, then your grade 1 promotion will be expedited. But these two courses, diploma as well as MSc courses, will not have any overseas training. And of course, certain MSc and diploma courses, from there you can proceed to MD courses. For example, community medicine, pediatrics. You would have seen in the Frank, most of the community medicine and pediatric people, they will place diploma and then subsequently MD. That is how they proceed. But you can stop at the diploma level if you want. Okay? But with diploma and MSc, you cannot function as a consultant. Right? You will be a medical officer. That's it. Okay? Now, there are some pathways which can take you to some higher level of training to get a consultant post, or in other words, a specialist post in your career. Okay? So, as I have told you, a lot of MD courses are there, right? So, this is basically available MD courses in medicine. So many branches, right? Starting from general medicine to so many subspecialty medical fields. And you have general medicine again, branches. Obstetrics, there are branches still. And of course, pediatrics, yes. Apart from your general pediatrics, you can opt for so many subspecialties. Psychiatry, yes, you have the general psychiatry as well as the divisions in psychiatry. Obviously, surgical surgery, general surgery, and the subspecialty. All are available. You can go for one of them. Okay? Similarly, anesthesia. And radiology, ophthalmology, clinical oncology, you have divisions. Okay? So it is not just general radiology or something like that. You can go for intervention. Ophthalmology, you can opt a particular field and then you can become a specialist in that. Similarly, oncology. So now the general pattern of the MD courses through PGIM will be, there will be a selection exam or the MD Part 1 exam with MCQ, essay and OSCE. Most of the fields, right? Some fields may be having some differences, but general pattern will be like this. And then you will be trained as a registrar in that particular field. And subsequently, you will sit the Part 2 exam for the final exam in that particular field. And you will have a training as a senior registrar for 1 year or 2 years. And then you will be allowed to go for abroad training, overseas training. And then once you come back after overseas training, you will have to face a portfolio assessment and a board certification Viva, and then for pre-board certification Viva, and then you will be certified as a specialist in that particular field that you select. So this is how the pattern will be. Now, the pathway I have told you, there are so many branches and there are so many fields. So you decide a career and then select the field, subspecialty, and then you can go for it. Regarding the postgraduate MD courses, whatever the field that you select, you must have extreme interest in that particular field. Having selected, that sort of mentality is not good. And because that particular field needs a lot of dedication to come up as a consultant. So first of all, you must like it, and then you must update your knowledge. Because the thing that I studied when I was MS Part 1, Part 2 student, may be outdated by now. After 10 years, 20 years, you have to read. You have to read and then you have to update your knowledge. So in MD course, a particular person who's carrying out that particular, or who select that particular field and proceed with that, you must update your knowledge. And then, as Dr. Gurubaran nicely highlighted, you must have a team spirit. This is not a one-man show. You yourself is not the only pediatrician, or you are not the only surgeon in the country. You are part of a team. So always try to have a sort of team spirit. You can't think that I have become a specialist in this. No, I know everything. No, don't think like that. So big-headedness should be abolished. And you must have stamina, right? After seeing two patients, that means I have seen that particular character in Australia. Even those who are coming from here, after seeing 5 patients, I am so tired with them. What is tired? I have seen 170 patients in the casualty ward. Still, I am prepared to work in the theater, right? So you must need stamina, and you must have the skill of observing and learning certain techniques quickly. And you must have some the attitude towards learning, right? And then you must have commitment to the profession. So just for the sake of becoming a particular specialty consultant, it's not commitment. As I told you, you must have extreme passion towards that, and then only you can master the particular field. Otherwise, you will be one of 100. That's it. And of course, you must work hard. There is no shortcuts. Shortcuts are there for a person who doesn't know the facts just to pass MCQs. Machan, that is the shortcut. Now you are going to deal with patients. This is something else. So there is no shortcuts. So that is very, very important. And patience and compassion, and of course technical skills, and more than all, precision. That is very, very important. When you are deciding to go forward towards a specialty, then of course the decision making and precision and accuracy is of utmost important, because your decision is going to be the final decision in the treatment pathway. So you can't make a sort of wrong decision for all the patient. On and off, it may be sort of faulty decision. That's fine. That is human, right? And mental alertness. So in the middle of the night, if somebody is giving you a call, then you have to make up your mind about the treatment plan, and you must advise them. You can't say, no, don't call me, I'll get up and tell you in the morning. No, that's not the way. Okay? Always you must be alert in that particular field, especially certain fields are really important. After becoming a consultant, now you can't say, no, I can't do this. No, you should know. You should be aware, okay, I will have to get up in the middle of the night because this is my field. After selecting the field, no, this is very difficult for me. No. That is how you should design your field, right? So, and then the responsible attitude, as I told you, and whatever you do like this, like I think I have done the lecture for you for the introductory lecture. Whatever the knowledge you have, how hard you study, that's fine. Ultimately, your exams. In your career, part 1 is one barrier, part 2 is another barrier. So you must prepare for it. So having all these attitudes and characters, you must prepare for your exams as well simultaneously. So the second thing is that once you have done the local training, definitely you will be going to overseas training. Some of you may be having family commitments. Some of you may be having financial commitments. And for completion of local training, you have a learning opportunity. What are you going to learn? You are going to learn in a new environment, new technique, advanced techniques, and another recently developed, worldwide accepted systems and management of patients. So you can learn those new techniques. When you come back, you can try to implement as much as possible, though you can't implement 100% that you saw there in the road. Of course, when you are finishing their part 2 training and as a senior registrar, some of your supervisors may find a job, or the PGIM will try to help you. So you can get a job and then you can go abroad for training. And in that case, you may have to leave the family in the country and you may be alone for some time. And sometimes you may take your family there, but your father and mother may not be coming with you. So you must be prepared for that. Okay? And some of you may be happy about that. Right? And obviously, as Dr. Gurubaran told, if you convert the money the money that you are going to get as a salary in abroad will be obviously high. So for the first time, you may be getting a sort of decent salary when you go abroad, right? And you will have a very good opportunity to stay there. If you are really clever, if you are really efficient, any foreign country would like to offer you job opportunity. Obviously, no doubt, right? I'm not telling that you have to do that, but I'm telling these are the facilities available. Option is yours. So, before deciding on career, my humble advice is that make sure you really like the field, and you must have a sort of full-time dedication, not a part-time business. And you must be capable of acquiring skills. And as I told you, you must be a team person. And also, you must have the talent of making a decision, right or wrong. Based on these facts, you must be able to make a decision, right? You can't just rumble to make a decision. Now, you make a decision and then proceed, right? So, decision is yours. When are you going to decide about the career, you just listen to your heart, nobody else, right? You have to decide your future. You can get advices, but you are the one who will decide your future, right? Knowing others is intelligence, but knowing yourself, your limitations, and your capabilities and talents is the true wisdom. I hope that you will have this. That's it. Okay. Right. No questions. Usually towards the end of my lecture, I usually ask any questions. No questions. Right. Thank you.